It's HIMSS 2018 right here from Nevada, Las Vegas, as we're introducing you to our CommonWell Health Alliance members. And now joining us from eClinicalWorks, he is the Director of Interoperability. It is Navi Gadhiok. And Navi, what does eClinicalWorks specialize in, and what kind of specific contributions will you improve to nationwide interoperability?
So eClinicalWorks is a privately held leader in healthcare IT space. We offer comprehensive practice management and electronic health record solutions to over 850,000 providers in more than 20 countries. We offer customizable and innovative solutions to different types of care settings, including our ambulatory surgical centers, primary care providers, behavioral health, and also including more than 50 specialties, which would be more around vision, dental, and many more. So connecting our customers to the CommonWell framework or network definitely would add to strengthening the network, and it would also help providers nationwide to access their patients' records right at their fingertips at point of care.
Yeah, and you touched about it just a second ago when it comes to maybe specific centered services, like the patient-centered services, the record locator, for instance. Maybe you can expound on that.
Sure. So CommonWell has actually built a robust system which allows them to find patient record no matter where the patient has been seen before. And that is the biggest advantage, where it actually provides a potential to the providers. It gives them an opportunity to find the patient records and use them to a level where they can actually truly impact the care that they're giving to the patients. Imagine if a patient walks into a practice and their provider already knows what's going on with them, what was done with them at a different care setting. It kind of gives that comfort to the patient to work with the provider as well. And secondly, when it comes to providers trying to integrate with these other providers, their peers, it is not cost effective. It's not worth the time to kind of spend to build those integrations. So with CommonWell, it eliminates that need of building a point-to-point connection. It is cost effective, and it definitely brings in a value to the providers to provide a better care quality to the patient.
Yeah, making it easy, making it as easy as possible for your customers. That's really that CommonWell difference, is it not?
It is, absolutely.
So Navi, how is eClinicalWorks making it easy for your customers to participate in CommonWell, and how does the onboarding process look to them?
So what we call at eClinicalWorks, interoperability is just a click away. We've actually made this on-demand activation tool, which is embedded right within our software, and that allows our users, our providers, to just basically, with a single click, activate the CommonWell integration within their local softwares within their system. So the on-demand activation tool does three things. It automatically registers their organization with CommonWell, and secondly, it automatically starts the process of sending the patients so that that enterprise master patient index could be built for their patients between the CommonWell network and their practice. And it also automates the process of when the patients are coming in for an appointment, the scheduled patients, it automatically would send out the query and retrieve their clinical data and keep it ready for the providers. So the data is right there available at their fingertips. They don't have to wait for anything. They don't have to wait for fetching the data from anywhere else. Have their data right within their system at point of care and provide that care to the patient.
Accessibility, on the ready, those are two of the most important things when we talk about interoperability. And I guess finally here, Navi, maybe share with us some feedback that your customers have provided to eClinicalWorks.
So far, the feedback has been great. We're hearing from providers, it's eliminating the need of reordering the tests that has already been ordered for the same patient at another care setting. We are also hearing from them that they don't really have to reach out to other providers now. They don't have to make those phone calls, request for fax to retrieve that data from other providers. It's right there. It's changing the whole experience that the provider is actually sitting with the patient, having that data right away available within the EHR. And I would also add to that by saying, over the course of time, we've seen a huge influx in our customers kind of participating and kind of showing the need of connecting to the CommonWell network I think they strongly believe in the potential of this CommonWell network and what it has to offer, which is the purpose of the network. So the feedback has been great, I would say, and we're seeing more and more providers trying to sign up to get connected.
Yeah, perfect, awesome. One of the very proud CommonWell Alliance members, and to learn more about eClinicalWorks, we invite you to log on to CommonWellAlliance.org. Thanks so much, Navi.
Thank you.